Heart disease is the #1 killer of both men and women in the U.S. But did you know there is a test that can determine your risk of a heart attack in the next 10 years?
Wow. Well, when it comes to healthcare, we know that rarely do we get anything for free until now. It's according to senior health correspondent Monica Robbins, who joins us live from University Hospital's Harrington Heart and Vascular Institute. Monica, you got to explain this.
Yeah, I do have to explain this. And ironically, this has been going on since 2017. So joining me now is Dr. Sanjay Rajagopalan, and he is the chief of cardiovascular medicine here at UH's Harrington Heart Vascular Institute. So where are we right now?
Well, you're sitting right in front and side of the Advanced Cardiovascular Imaging Center. And this is a construct that we put together many years ago that brings together the latest technological innovation in imaging, cardiac imaging, together with interventional approaches. And right next door, my colleague and the director of the Harrington Heart and Vascular Institute, Dr. Mehdi Shishibo, is doing an advanced peripheral intervention. So this is what we do every day, and using imaging to guide interventions, particularly advanced interventions, is sort of the specialty.
But let's talk about calcium score, because that's what we're here for. That's what we're going to do. What is a calcium score?
So a calcium score is a CT scan, which is a sophisticated X-ray that detects calcium deposition in the arteries in your heart. And it turns out it is the best predictor of future cardiovascular risk.
But why doesn't insurance cover this?
Well, it's one of those mysteries in American medicine, right? Some of the most important things that can really save lives, and are also preventive therapies are not reimbursed for, but that's hopefully changing.
That's changing, but since 2017, University Hospitals has done 125,000 of these for free. Are they still doing them?
Absolutely. I think this is a commitment that University Hospitals, the Harrington Heart and Vascular Institute, working together with the Department of Radiology, has made to the community that we serve, because we really think this is important. This is important for prevention and identification of risk so that patients can be empowered with information that they need to modify their behaviors and take the appropriate medications.
So who needs one? So if you're 45 years or older, if you have high blood pressure, if you have high blood cholesterol or low HDL, if you're a smoker, type 2 diabetes, family history of heart disease or chronic inflammatory conditions, all you need, you can be a patient at any other hospital, but you need a referral from your doctor, right?
That's right. You need a requisition, and that's it. If you meet the criteria, if you happen to have risk factors and you belong to intermediate risk category, as defined by the American Heart Association, American College of Cardiology, you can get scanned for free.
All right. So coming up at 5, I'm getting in this machine. I'm going to get a scan and show you exactly how easy it is. And then coming up at 6, we're all going to go over my results together, guys.
Wow. Monica, okay, this is big.
Yeah.
And honestly, this is big for you, but this is big for so many people watching who are at that point where they're saying, you know what? I need to get my health checked. The heart's so important as we talk about the death toll when it comes to their deaths, when it comes to hearts. So we'll see you then. We're looking forward to it.
You got it.
Okay, thanks.
Welcome back to 3 News at 5. Our senior health correspondent, the fearless Monica Robbins, has never been shy about taking us along on a health journey or two. But today, she's showing us what it's like to get a calcium score test that, gets this, could predict risk of heart attack in the next decade. She's doing all this on live TV.
Yeah, she's actually wired up right now and in the CT machine, about to get the scan here. So let's talk to the doctor at hand here, Dr. Sanjay Rajagopalan. I think I said that right. Thank you so much, doctor, for being with us. I know you're the chief of cardiovascular medicine at UH Harrington Heart and Vascular Institute. So help us understand, first of all, how long does the scan take and what precisely are you looking for?
Well, it's a 2-minute scan, believe it or not. And what you're looking for is calcium deposits in your coronary arteries. And it's one of the best tests to give you a sense of your risk for future heart attacks and other cardiovascular events.
How reliable is this test, and how is it that it can actually determine risk a decade out?
Well, it's not as if it's determining risk, period, but it gives you a good sense of the probability of you having a major cardiovascular event over the next decade. But the way it does this is detect calcium deposits in your arteries, and those deposits indicate that there's active inflammation and other processes in your arteries that give rise to what we know and recognize as heart attacks.
Okay, so how much does it cost, and is it covered by insurance?
Well, this might surprise you and shock you. This is offered completely free. University Hospitals Harrington Heart and Vascular Institute has been doing this for free since 2017. We have done over 125,000 scans, and we really believe that providing this information to patients and physicians really empowers individuals to do the right thing in terms of lifestyle changes, as well as take appropriate medications and reduce future cardiovascular risk.
Now, doctor, we were just talking in the commercial break. This is a fairly risky pop quiz that Monica will be taking here on live TV. What if we find something on Monica, and what is the scoring system?
Well, you know, Monica is a courageous individual, obviously. She's doing a live experiment, as you can see. And this test will essentially determine what a future risk is. And this is, by taking this step, is really showing people that not only is it important to take this important step to understand your risk, but also the fact that it's very easily done. You know, the fact that it's done within 2 minutes, and literally before you know it, you have the results. Wow. is very powerful.
Oh my goodness. Dr. Sanjay Rajagopalan, thank you so much for explaining this to us. There she is again. So coming up at 6, we should tell you, Monica and the doctor both bringing us her results. Thank you so much for walking us through this.
Pleasure to be with you.
Pleasure to have you. Thank you, sir.
Welcome back. There is a test at UH that you may not know about that could save your life. It's called a calcium score test, and it's free.
Well, first of all, it's free, which is good news, right? The test is done in less than 2 minutes, and it lets you know if you're at risk of having a heart attack in the next 10 years. So within the last couple of hours, just the last 2 hours, our senior health correspondent, Monica Robbins, took the test live on air.
Once she arrived at the hospital, she got into that machine you saw there for a CT scan of her heart and arteries. By the time the doctor was done explaining, that test was over and her results were in. So let's go to her live from University Hospital's Harrington Heart and Vascular Institute with those results. Hi, Monica.
Hi, guys. Yeah, you know, UH has been doing this test for free since 2017. They've done 125,000 of them. They average about 2,000 a month. If you fit the criteria, you get a referral from your doctor. It doesn't matter what hospital you go to, you too can get a free test. So Dr. Sanjay Rajagopalan is about to give me my results live. What am I looking at here? What is all the pink?
So this is an image of calcium deposition in the arteries. And this, I got to tell you, Monica, this is very concerning because this tells you that this individual is at high risk for cardiovascular events, including a heart attack. And that's fortunately not you.
Woo, okay, good.
Okay, let's look at your scan here. And this again shows me calcium deposits. And thankfully, you don't have even a ditzel of calcium in your arteries, which means that your calcium score is 0. Wow. And remember, we did an estimation of your 10-year risk where I plugged in your numbers. You're a 57-year-old individual with no hypertension. You're pre-diabetic. Your cholesterols are okay, but you have a strong tendency, family history of a number of metabolic disorders and heart disease. So this really allows us to fine-tune the estimation of your risk over the next 10 years. And the calcium score does that because it's a very personalized measure of you. And the fact that you don't have calcium deposits in your arteries and your calcium score is 0 really gives us confidence that your likelihood of succumbing to a future heart attack or stroke is very low.
So what's my percentage of possibly having a heart attack in the next 10 years?
So previously, when I plugged in your risk factors, your risk was 1.9%, which is low, but there were concerning factors that you had in your history. And now, after plugging in the calcium score, it gives me a better refined estimate of what your risk is. And it came down from 1.9% to 1%.
Wow, 1% of a chance. Well,
in the
that,
next 10 years.
oh
So
my goodness. Well,
is that a relief or what?
that is a huge relief.
Fantastic.
And anyone who fits the criteria, again, can come to UH and get this test for free. I put the information on WKYC.com, everything you need to know and how you can reach out and get that information. So that's all you need to do, guys. Back to you.
I can tell you, he about gave us a heart attack when he showed that first one. And he's showing all the deposits, and we're thinking, oh my gosh, so glad that it worked
You
out.
thought that was
Mom.
my heart, didn't you?
Well, yes, we did.
Glad all is well.
I was just very glad to see I had a heart. So
Oh.
there's that.
We all know you do, Mon. One of the biggest. Thanks, Mon.